Well, so far, the recommendation is that yes, you ought to get vaccinated even if you've had COVID-19 and recovered. We're not sure exactly how effective and how long lasting the antibody response is and the innate, what's called the humoral immune response is after COVID-19 infection. The general recommendation right now is to wait about 90 days after resolution of your infection to get vaccinated. It's my professional opinion that, with very few exceptions, everyone out there ought to get vaccinated. People who probably should not get vaccinated are people who had very severe anaphylaxis or anaphylactoid reactions from previous vaccines or from other causes. But even those people can get vaccinated in controlled situations with medical treatment available. So far, to my knowledge, nobody has died from COVID-19 vaccination. Okay, so how many shots do you have to have? The Pfizer vaccine is 2 shots spread 3 weeks apart. The Moderna is 2 shots spread 4 weeks apart. The Johnson & Johnson vaccine is 1 single injection. Can you take just one of the 2 doses? Well, you can. I wouldn't recommend it. The studies have been done on 2 doses, and so I can't give you any hard and fast reassurance that the 1 dose of the Pfizer Moderna are going to be protective. Should you take your 2nd dose at the first site that you went to? The answer is yes. Occasionally there may be supply problems with the 2nd shot, and people may have to scramble to get their 2nd shot at another location if they can. So do you have to stay with the same shot the 2nd time? And the answer is yes. These shots work by different mechanisms, provide different immune responses, and so the definite recommendation is that you stay with the same shot that you had the first time. So which vaccine should you get? I'd recommend you take the first vaccine that you can get and get that jab in your arm as quickly as possible. There's no evidence really at this point that one vaccine is better than the other. So how much time has to elapse between getting the vaccine and protection is not well established. The best guess is probably within 2 or 3 weeks after your 2nd vaccine for Pfizer and Moderna. And actually the J&J seems to have a little bit of an advantage by having good protection 2 weeks after the single injection. For people who've had the COVID-19 infection, they should be vaccinated. The general recommendation right now is to wait about 3 months to get the vaccination started. So what about vaccine side effects? Well, these vaccines do cause side effects. Fortunately, they appear to be fairly minor in nature. Pain at the site of the injection, a sore shoulder, low-grade fever, feeling poorly for a couple of days, fatigue. These side effects are minor, not long-lasting, and pale into insignificance compared to actually getting COVID-19 and having a moderate to severe or a severe case. This is a really nasty illness that puts people in the hospital for a significant length of time, puts them on ventilators, and there's also an appreciable risk of dying. If you want to talk about the potential interaction with vaccines and medications, at this time there appear to be no difficulties with that, with any medication patients are taking. It's possible for people who are immunosuppressed, for example from cancer chemotherapy, that they could have a reduced immune response, but that doesn't mean they shouldn't take the vaccine.